I'm Chung. Welcome to the In the Know video series. So I have today with me Dr. Ksenya Shliakhtsitsava. She's an assistant professor of Department of Pediatric at UT Southwestern and one of the members of the CCDD, or our cancer program at Children's Health. Welcome.
Thank you. I'm excited to be here.
Yeah, I was looking very much forward to this conversation. Let's start with your background. How long have you been here?
In 2018, I joined UT Southwestern as a faculty member to build Fertility Preservation Program, but also to help with our survivorship program here. So I'm doing clinical work and research.
Sounds like, obviously fertility preservation and cancer survivorship almost go hand in hand.
Yes, exactly. I truly believe that survivorship starts at the time of diagnosis.
Yeah.
So we need to think about our patient's future at the time of diagnosis as we're having discussions about treatment, because expectation and hope for each child to survive their disease, their cancer, and we want them to have best quality of life possible. I feel like nowadays it's not satisfactory to cure their disease. We really want to thrive for great quality of life. We want them to go to school. We want them to participate in sports. We want them to have their children biologically if they desire.
In 7+ years, what has being able to establish a program been like?
We were able to put together a truly multidisciplinary team of providers and supportive staff that support our fertility preservation program. We collaborate with gynecology, with urology colleagues. We have specialized team of nurses, psychologists, social workers, and child life specialists that help support our program. We were able to hire a dedicated fertility navigator that serves a liaison in between our program and family, and really true advocate for our patients and their future. Now we systematically assess each patient's risk at the time of diagnosis and meet with families, discuss the risk, and provide guidance with those difficult decisions.
When we talk about fertility preservation, it would seem kind of common sense, but I'm sure there are a lot of intricacies involved. I wonder if you can kind of elaborate.
It is important for us to assess each individual patient at the time of diagnosis. So we'll look at patient's age, at their stage of pubertal development. We'll look at the type of diagnosis they have, what treatment they're proposed to receive. We also need to look at patients' and families' preferences and values, because that might inform their decision. Once we have all this information together, we formulate recommendations for fertility preservation. But we always think about what's the best option that is available. When it comes down to options that we would discuss with patient and family, it depends on patient's sex and also their stage of pubertal development. For boys, we have sperm banking available, but this is something that is available only for those boys who are more mature and able to produce a specimen. For younger boys, we have testicular tissue cryopreservation available, so that can be considered in patients who are young, who undergoing through puberty, who already went through puberty, but for whatever reason unable to pursue sperm banking. But this is more of an experimental approach. We do have a clinical trial open at Children's Health. For girls, the options depend on how far through puberty this individual is. So for example, we have egg freezing or oocyte freezing available for our patients, but this option only available for those girls who are older and went through puberty. For patients who are younger, or when we don't have enough time to pursue and delay their cancer treatment, we consider ovarian tissue freezing. This is when one of the ovaries gets removed and frozen for their future use. So for all those invasive procedures, we always consider risk of infertility, right? So for somebody who is not at high risk, we would not offer those options. They're available, but it might be not necessary. But for patients who are exposed to very high gonadotoxic treatments, this is something that we would recommend and suggest. And it would be up to family to decide if they would like to pursue more of those invasive therapies.
So for patients with newly diagnosed cancer, let's say a preteen, is it safe to assume that all patients are being brought in for further evaluation and completion, and as well as starting the treatment, that you and your team of expertise and fertility preservation program would visit with them? Or is it like when the teams actually have to actively seek a consultation to you?
By default, we offer this discussion to all of our patients and
Great.
families.
Yeah.
As their primary oncologist discusses their treatment with them, we actually assess in collaboration with their primary oncologist the risk of infertility, and we would come and discuss this with patients and families. We're here to really help and support families through those decisions, to really navigate through this journey with us, not only through cancer journey, but also through the journey of whether it's fertility preservation or other risks that can be associated with the previous cancer treatment. We collaborate with UT Southwestern Fertility Preservation Reproductive Endocrinology Program for oocyte and egg freezing and sperm banking.
What some exciting programs or these clinical trials are you conducting currently?
Right now we have clinical trial of testicular tissue freezing. I'm also working on developing improved counseling for patients in adolescent and young adult years before they transition care from Children's Health to adult program to UT Southwestern. So I really want to empower patients and understand their risks associated with treatment before they transition their
Right.
care, so they know how to advocate for themselves. But also I want to have this advocacy on the provider level as well, and how we can leverage technology, electronic medical record system to inform receiving providers, adult providers, about their patient history. We're trying to work with Epic team to see if we can build on this, provide treatment summaries, for example, electronically, so patients have all their information, all previous treatment and exposures, essentially all details of their journey through treatment in one document. And we really want to cross those walls in between pediatric and adult centers, how to harmonize this care.
Well, it's been great getting to know more about you and your program, and thank you for all that you do.
Thank you. Thank you for this opportunity to share with all our patients and families and colleagues. I'm really excited about our program, and I truly believe, as I said, survivorship starts at the time of diagnosis. So we need to think about our patients and their future from the very beginning and really, really allow them to have best quality of life possible. I think it's very important, and I feel like we're fortunate to help and achieve that.
Couldn't agree with you more.
Yeah.
Thank you, Ksenya.
Thank you.
Great.
Great.